We are so pleased and glad that the new guidelines that we've been waiting for so long are finally out.
I'm so happy to learn about TPT and to understand what it means.
What I'm really excited about is that now the entire family can get protected from TB.
Akunoba ngcono ukuba ngaba intombi yam yaye yathatha uthintela we-3 months kunokuba ithathe i-treatment ye-6 months.
If we want to end TB, we need to scale up TB preventive therapy to all those people who are eligible.
Hi, my name is Goodman Makanda. I'm an ex-DTTC survivor working for TB Proof, that is an NGO trying to help people to end TB. I'm introducing you to the family of Machicha behind me.
Igama lami ndingumzukuseni, fana ndingumsawuli, ndihlala eKhayelitsha eNkanini, ndihlala nosisi wami nomama notata. Ndaqala ukugula ngonyaka 2021 ngoJuni. Qala kwami ukugula, ndaqala nakhohlela, ndabila. Kase kabuhlungu umzimba wonke. Kakunto ibilapha. Ndaya ekliniki. Xa ekliniki natestwa, sabuya iresult ekuthiwa ndine-TB. Kwakulo nyaka lowo kwabuya kwazogula nosisi wami, kamazi bagula yintoni. Naye wayesiwa ekliniki. Xa naye ugula lena i-TB lebe ndinayo kwami. Sanikezwa ke ngoku ipilisi eze-TB. Eqala nazitya mna before yena.
Igama lami ndinguziyanda Sajini. I am 19. Kukho ubhuti behlala naye ekhaya. She was also have a TB. So bendifumane pha kuye yena kuye ingxaki lapha emzimbeni apha emaphapheni. Kum ibilapha entanyeni bendineqhuma belapha emqaleni. So ndingaqapheli uba kwenzeke ntoni. Bendibashushu emzimbeni, ndikhohlele, ndigabhe. So ke ngoku ndingasazi uba kutheni. Ndahamba ndaya ekliniki. Ekliniki ke ngoku batsala apha iqhuma apha emqaleni, batsala igazi, then bayolithesta. Then ke ngoku bafumanisa uba okay ndine-TB. Ndazitya iipilisi until 6 months. Then ngoku ndaphinde ndaya kwagqirha, wathi ugqirha ndifila njani. Ndamxelela uba okay ndifila right, yonke into i-right.
Ndinguzamile igama lam Ngxalaba, ndineminyaka eyi-61. Ndihlala nenkosikazi yam nabantwana bam ababini. Abathe bachatshazelwa yi-TB. TB leyo iqale ngalo ungumfana. Ndithe ndisajongile loo nto leyo yachaphazela lo intombazana. Landinceda isebe lezempilo labanyanga baphila bobabini. Ukuba ndandazile uba ikhona indawo enothi incede ivikele ithintele kuqala, kwakufanele uba lo intombazana ndimsile ngengazange yamchaphazela, kodwa ngenxa yongazi. Ndiyacela bahlali balapha kule ndawo ukuba ibalulekile into yokubana siyozijonga ekliniki. Okwesibini, ibalulekile into yokubana sithintele eli gciwane lingekafiki kuthi, ulungiselele into yoba lingabi sasiphatha.
It's important to know about TPT. Now the new guideline make it possible to all close contact to get a protection against TB.
I normally work in the child health clinic, but I'm allocated to work in the TB room. So I've been sent for TB training for 1 week. We trained about to interpret the results, to diagnose TB, to treat TB, about the medication. We didn't learn about TPT and TUT. So what is that about? Can you tell me more?
In March 2023, the National Department of Health brought out new TB guidelines. The guidelines are the treatment of tuberculosis infection. We as the Western Cape Department of Health and the Khayelitsha Eastern Substructure as an area are happy to receive these guidelines and will ensure that it gets implemented in the primary healthcare facilities. So for many years we did implement TB preventative medication. It was called INH, and it was mainly for people who had high risk of TB infection, mainly young children and people living with HIV. Part of rolling out the new TB infection policy is working with NGO partners such as TB Proof to ensure that we inform our communities about the new policy and also mobilize them about the service that they can be provided for at our facilities.
Treatment of TB infection, what does that mean? How does it relate to TB prevention?
So TB infection means that the person has got TB in their body, but their immune system is strong and it's able to control the TB so they don't get sick. This is sometimes called latent or sleeping TB. If the person's immune system becomes weaker, they can no longer control the TB and the bacteria start to multiply, and this makes the person sick, and so they will have some or other symptoms of TB. The typical TB symptoms are very well known, but some people who have TB don't have any symptoms at all, and recent research has shown this is far more common than we realized. This is called asymptomatic TB. This is a big challenge because they won't go for TB testing, and if they're asked about the typical symptoms like fever, loss of weight, night sweats, etc., they will answer no.
So what is TPT then?
TPT is TB preventative treatment. It's TB medication that's used to treat TB infection and prevent it from progressing to disease. It's given to close contacts of somebody with TB disease and somebody who may be at risk for any other reason because they're immunocompromised.
And what is a close contact?
Remember how we used to define close contacts in time of COVID? It's the same concept. It's people who live in the same household as somebody who has TB disease, or friends and family who visit often, or work colleagues, or even people who share the same transport as somebody with TB disease.
Like in this family, Mzukiseni had TB in 2021. Mzukiseni's close contact was a mother, a sister, a granny, and a father. If it was possible on that time, they should be getting TPT to end TB.
So how does it work then? Do we just give TPT to all close contacts of someone with TB disease?
First, we have to find who the close contacts are. So the TB nurse will ask the person who has TB disease who their close contacts are, and they'll be asked to come into the clinic. Also, the community health workers will do a home visit and also find contacts there. Those people will be asked to come to the clinic and then be tested for TB. We can't just rely on verbal screening alone because then we might miss asymptomatic people who have TB disease.
So how do we rule out TB disease in close contacts?
For people over 5 years of age, they need to come into the clinic and provide a sputum sample or a chest x-ray if they can't provide a sputum. For patients who have HIV and CD4 counts are under 200, we can also do a urinary lamb test. For children under 5 years, a sputum sample or chest x-ray is not necessary to start TPT if the child is well.
What medicines do we give for TPT? Is it the same as the INH, the 6 months IPT?
There are two very important changes to the new guidelines. The eligibility criteria, so those people who can have TPT now, include all contacts of all ages, regardless of HIV status. And they have the options of 6 months of INH or of 3 months of INH and rifapentine, which we call 3HP. It's much shorter, it's only for 3 months, and it's once a week.
The national guidelines recommend 4 possible options, either taken once a week for 3 months or daily for 3, 6 or 12 months. 3HP is isoniazid, 3 tablets, and rifapentine, 6 tablets taken once a week for 3 months. It means it's 9 tablets taken only over a period of 12 weeks. 3RH is isoniazid and rifapentine in a fixed dose combination taken daily for 3 months. It's the ideal option for children taking TPT. Isoniazid taken daily is the regimen that we are all familiar with. This is also the recommended regimen for those starting on dolutegravir antiretroviral therapy or those who are already on PI-based antiretroviral therapies. We will also recommend isoniazid daily for pregnant women. To prevent potential side effects associated with TPT, we recommend pyridoxine.
Wow, this sounds wonderful. Is there any contraindications for taking 3HP? Can it also be used for adults and children?
These are the main contraindications to 3HP. Currently, we do not recommend it for pregnant and breastfeeding women and also in children younger than 14 years old. Any patients starting on dolutegravir should not be started on 3HP. Women taking oral contraceptives need to use a barrier method as it reduces the efficacy of the oral contraceptive.
What are the side effects for 3HP?
Unfortunately, any TB treatment can cause side effects, but it's less likely on these treatments compared to the 4-drug regimen. What we do is we advise patients to come in if they are feeling unwell or if they're experiencing any symptoms. The doctor will then decide if it's related to TPT or not. And if the side effects or the symptoms are related to the drug, there's a possibility of us stopping that drug.
Ndicela ubuza ke ngoku sisi ndingalifumana phi uncedo lwalwepilisi ikhuselayo?
Kuzo zonke iikliniki zikarhulumente mama ezilapha eKhayelitsha unako ukuya uyifumane ipilisi kathintela we-TB.
Who can prescribe 3HP?
The people that can prescribe 3HP are doctors or TB authorized nurses.
Is there anything else we need to do for the context of the patients that has TB disease?
It's not easy to take any treatment for a long time. So what we need to do is provide support and encouragement to our patients and help them through the journey.
What patients need and the family from the healthcare workers is a loving care and support, including even the community healthcare workers to go and support in the community.